Welcome. We're going to go ahead and get started. Thank you so much for your participation this afternoon in our workshop entitled Tackling the Zika Virus, Strategies Used by Local Health Departments to Increase Maternal and Child Health Capacity. My name is Laura Viennes. I'm a physician trained in preventive medicine. I spent greater than a year in CDC's Emergency Operations Center working on the Zika response, and am currently working on the impact of Zika virus during pregnancy as a CNI contractor in the Division of Congenital and Developmental Disorders in the National Center on Birth Defects and Developmental Disabilities at the CDC in Atlanta, Georgia. I'm grateful for the opportunity to attend this conference and to learn from all of you. So let's get started with the content of our workshop. You'll hear from me for the next 5 minutes or so with a very brief background of who we are, the problems that are associated with the Zika virus, and how this local health department initiative seeks to impact the maternal and child health community. Next, you'll hear from our panelists as they describe their experiences as field assignees in their local communities. Then we'd like to hear from you, so please make a note of your questions as the panelists are speaking. And we also hope that you'll share some of your related experiences. Finally, we'll regroup, and our panelists will offer some advice to those seeking to implement similar strategies for Zika and also for other issues important in your local community. So the Chickasaw Nation in Oklahoma is one of the most economically successful tribes in the United States. Chickasaw Nation Industries was created in 1996, has more than 2,000 employees in greater than 40 states. It has 6 operating divisions, including business support services, defense logistics, health and human capital, IT solutions and services, manufacturing, modeling, and simulation. The company vision is to achieve self-determination through economic success, which is the heritage of the Chickasaw people. The company values and rewards hard work, innovation, and service without reservation. Because a Zika virus infection during pregnancy can cause severe birth defects, including microcephaly or a very small head size, as depicted here, CDC established the U.S. Zika Pregnancy Registry early in 2016. By capturing, analyzing, and disseminating information about pregnant women and their infants, we seek a better understanding of the relationship between Zika virus and birth defects. As of January 23, 2018, CDC has collected information about 2,191 pregnancies, completed pregnancies in the U.S. that have been associated with possible Zika virus infection, and 3,915 in the U.S. territories. This includes 247 live-born infants, 106 in the states and 141 in the territories, as well as 17 pregnancy losses with Zika-associated birth defects. Zika has had a great impact on U.S. women and their infants over the past 2 years. Building local maternal and child health capacity is critical to prevent and diagnose Zika infections, to provide sustainable services to the pregnant women and infants who've been impacted by Zika. CDC's Zika Local Health Department initiative was created to improve local health department's ability to provide sustainable services to those that are most impacted by Zika, that is, pregnant women, infants, and their communities. There are 5 goals of the LHD initiative: to strengthen collaboration between public health and healthcare providers, to provide a skilled person to help local health departments meet the needs of their communities, and these skilled public health nurses and epidemiologists are known as field assignees. The 3rd goal is to mobilize the maternal and child health community to collaborate with CDC, partner organizations, field assignees, and local and state health departments. The 4th goal is to engage partner organizations to share knowledge, skills, and experience. And finally, the local health department seeks to use existing CDC resources to support field assignees in addressing the needs of mothers and infants. In late 2016, early 2017, eligible local health departments applied to CDC for support through the Local Health Department Initiative. CDC conducted site visits to each local health department to gain an understanding of the needs at the local level, to develop tailored plans, and to rapidly deploy field assignees. CDC placed assignees in 27 jurisdictions, primarily in areas that have risk of local spread of Zika due to their local mosquito populations, and in areas with a high number of people who travel to other countries that are known to be areas with risk of Zika. The field assignees will help local health departments respond to Zika virus through August of 2018. The local health departments where field assignees have been placed are shown in the map on the right of this slide. So our panelists today include several field assignees from our local health department initiative. Henry Pressas, Field Assignee to Brownsville, Texas Local Health Department. Michelle Angetine, Field Assignee to Broward County, Florida. And Jessica Schultz, former Field Assignee to Fairfax County, Virginia's Local Health Department. Henry Pressas serves as a public health outreach nurse. He provides Zika-related field support to the City of Brownsville Public Health Department in Texas as part of the CDC Local Health Department initiative under a CDC contract with CNI. Henry's area of focus within the Brownsville Public Health Department include provider outreach and engagement and community outreach and education. Prior to his role with CNI in support of the CDC Local Health Department initiative, Henry served as the patient-centered medical home coordinator at Clinica Harlingen in Texas, and numerous managerial roles at Valley Baptist Medical Center, Brownsville. He also served as Performance Improvement Director for Texas Visiting Nurse Service. He's received several awards throughout his career for excellence in nursing and service. Michelle serves as the Public Health Outreach Nurse, providing Zika-related field support to the Florida Department of Health in Broward County. Michelle's area of focus within Broward County include provider outreach and engagement and community outreach and education. Prior to her role with CNI in support of the CDC Zika Local Health Department initiative, Michelle worked in special immunology OBGYN research at the University of Miami Health System, where she supported disease management for HIV-positive female patients. She also served as a case manager for Florida Hospital Heartland and worked in the Med-Surg Oncology Department at North Shore Medical Center. Jessica Schultz currently serves as the Fairfax County Health Department District Epidemiologist, but she recently transitioned from her role as a CDC Local Health Department Initiative Field Assignee. Her focus with CNI was on Zika-related provider outreach and engagement, community outreach and education, and surveillance and reporting for the Fairfax County Health Department in Virginia. Before she came to CNI, Jessica served as a senior epidemiologist at the Northern Kentucky Health Department and an exercise physiologist for Christ Hospital and TriHealth in Cincinnati, Ohio. She holds an MPH in Health Promotion and Education from the University of Cincinnati and a BS from the University of Louisville. With that, I'd like to turn the microphone over to Henry to discuss his work in Texas.
Thank you, Nora. I'm Henry Pressas. I'm the Field Assignee for the City of Brownsville, located at the southmost tip of Texas, the very bottom. Okay. We are the tip of the spear in border health protection, the tip of the corridor in prevention and surveillance. Like everyone else, we are the tipping point. How to handle a problem with limited resources, but again, to be resilient. Okay. Our dilemma is that Brownsville has had many firsts in dengue, chikungunya, and Zika in Texas. In November 2016, we got our Thanksgiving surprise, our first locally acquired Zika case. By the end of December, we had 6 cases. Today, we have 38 cases in Cameron County, 466 throughout the state, and mostly travel-related. And to date, our southern neighbor, Tamaulipas, has 784 cases. Another first is in 1993, Texas developed a Texas birth registry. Due to, in 1991, there were several cases of anencephaly in Brownsville, Texas. Now, 25 years later, Zika is changing how we do things again. Surprise, surprise. Brownsville has a population of 183,000 people, which borders Matamoros, Tamaulipas, which has 750,000. To us, Matamoros is a neighborhood, not a separate nation. Actually, where we're sitting right now is my local health department. If you cross Highway 1, that's Matamoros. That's how close we are. Estimates state that within a 10-mile radius, we have 10 million people living on both sides of the border. Okay. We have 1 million northbound crossings at 4 bridges in Brownsville. We have a very fluid border. That's just life in general. We also have a very humid subtropical climate. It's a great place to live. We have great golf courses, fishing spots, outdoor activities, and yes, we have mosquitoes. We have 39 of them, and we have them year-round. Okay. Our median income for Brownsville is $34,000 compared to Texas, which is about $54,000, and in colonias, it's $5,000. What's a colonia? A colonia is a rural settlement of Mexicans or Mexican Americans. Okay. Brownsville has about 15 colonias in and without the city, and Cameron Park Colonia within Brownsville is the poorest in the nation. The poverty rate for Brownsville is 38%, and also the primary language in Brownsville, 70% speak Spanish. That's the primary language. As you hear by now, Brownsville is uniquely at risk due to the emerging diseases, due to the border, population density, financial resources, and effective presence. And to that, we had to be proactive and fiscally responsible. So we created a GIS map. Okay. We plotted mosquito trapping data, medical professional locations, outreach activities, specialized vector activities, resident mosquito requests, and 80s Egypti locations. The map identified areas of targeted opportunities for outreach and vector control to diverse populations throughout the city. In August, it was used to acquire the Clark Buffalo turbine. This is a sprayer on steroids. You've seen those sprayers, mosquito sprayers around cities. This one will spray particulate up to about 125 feet up in the air and can spread 200 feet laterally. Depending on the wind, it can even be more spread. So we get better bang for our money. And with that, that 1 month activity was done in Brownsville with a cost saving of $800,000. So we're very happy with that. As my public health director here, Art, can attest, he's very happy. Okay. And this also was the first time, yeah, we're happy, like 800,000, yes. It was the first time used in Texas too, so another first for Brownsville. This map also highlighted areas of education and vector activities. To us, it basically showed us, okay, where do we need to reach out to? What are we missing? Are any gaps? Is there anything correlating? Nowadays, we're looking at stormwater drains because we found 80s mosquitoes where there shouldn't be any 80s mosquitoes. We scratched our heads. We noticed that some houses with nicely manicured lawns had high 80s, and that was basically to the population, the flora, the plants they were selecting was a good habitat for mosquitoes. Also, some sprinkler heads were holding enough water to grow mosquitoes. So that's something we started finding. Okay? And the bottom line is, if you live in a desert in Brownsville, you're fine. But we're subtropical, we have mosquitoes. Okay? We're also working with EPA to get a 1 meter by 1 meter map of Brownsville to show us areas of high risk for 80s habitat. With this, we're going to go ahead and incorporate it and develop some more strategies to mitigate the mosquitoes. Okay? The best value of the map is actually, Art and I, we're getting reports all the time. We have books of reports, and we're afraid to look at it. Once we put it on the map, it was easier to understand. Okay? Well, to our staff, it brought in great buy-in. They are able to see, oh, we went this, we did this, oh, we've done a lot. To our political people, we've been in your section, sir. They were very happy. And overall, the public, it keeps noticing the more we do, the better we get, and they kind of help it. They love it. Okay. Sorry, excuse me. Along with being proactive, we needed to be innovative in our approach to outreach. One of the things we did a regional Zika Action Day. In 3 counties in South Texas, we all got together, selected the date, and basically made it a region-wide Zika Action Day. It was very successful. We had partners, our stakeholders were there. It was a very good event. And the residents really liked it, so even so. We also highlighted our work in Matamoros by national effort. We started with simple handouts, using culturally specific language at Brownsville's level, because it's a different type of Spanish than the rest of the state might use. We also use artwork that we can use on both sides. Matamoros came up with a design, and we printed it, and we passed it out, so win-win. Matamoros Health Department also participated in our Zika Action Day, making it one of the only binational Zika Action Days and that has been done. Yay, another first for us. Okay? And also with Matamoros, we're continuing to work with them, not just for Zika, but for diabetes, obesity, poverty, and other health issues that we're trying to address right now. So it's very important communication. We also created some innovative education materials for the community. The first one is a Zika Hero Badge, the little badge with a circle mosquito. It's a little badge that you buy a label and put that on. I use it a lot during our outreaches. I go up to families that have little kids and tag the kids, start talking to them, and basically go over those 3 steps. And that kind of gives me an opening to the parents, and we start talking, and then it goes on and on. So, and everybody likes a little badge. They walk around with the badges. It looks pretty. Okay. Another thing we did is we created a Zika Jeopardy game. Actually, this is great. when I start presenting at colleges or schools or even at the community, it's like, I want to play Jeopardy, I want to play Jeopardy. And it's educational and it's fun. Actually, we spread this out to the other field assignees and the rest of the 24 that we had, and they've changed it to their locations, and they're using it, and they're doing quite well. A real crowd pleaser. The last thing we created basically is a Zika display board. It basically emphasizes the Zika virus, the complications, the dispersion of the disease, testing procedures and follow-up, and then also vector mitigation. It's a great tool to use whenever you don't have, you have a lot of people, a lot of rooms. You're talking to somebody comes up, they start reading, and then you can lead in. Also, it's happened a couple of times where the computer fails, battery dies. It's like, oh, here's my board. And so I like to use the board. Okay? And otherwise, we're still continuing to evolve as we're trying to find more data to plot, trying to see what activities, and trying to see what the public needs. And with that, I'll go ahead and pass it on to Michelle.
Thank you, Henry. My name is Michelle Etienne, and I represent Broward County Health Department from the state of Florida. Broward County Department of Health is one of 67 public health departments under the governance of the Integrated Florida Department of Health. And our motto is our best and nothing less. I don't have much to say about Florida. You guys know it's beautiful. Broward County's population is approximately 2 million residents, 32.7% of which are immigrants. We receive about 10 million annual visitors. The poverty level is 14%, and 80% of the live births that we have annually are from moms who are enrolled in WIC programs. Zika. 90 to 95% of our Zika cases are from Caribbean immigrants. 5 to 10% are from tourists. Now, as you guys know, we're next door to the Caribbean, so it's only natural that most of the cases we have are from the Caribbean. In 2016, we had 182 travel-related Zika cases that were reported. We had 1 local case, and 3 of them were undetermined. So, well, as of 2017, we've had 31 travel cases. All the cases we've had so far have been travel. The Zika Community Outreach Nurse, that is the job title. I personally call myself Olivia Pope when I'm by myself. And this pretty much highlights some of the aspects of being Olivia Pope. As the facilitator, I link providers, clients, local and state health department personnel, and local community resources to each other. As the educator, I share educational toolkits outlining current testing and management guidelines with healthcare providers and epidemiologists, meaning I go to different hospitals throughout Broward County and I speak to their epidemiology departments, and we come up with some protocols as to how to test and what to submit when the babies are born. The finisher assists healthcare providers with adherence to sample collection and submission procedures. The WIC lady, as my clients call me, teaches pregnant women and family members at 8 weekly WIC breastfeeding classes. And finally, the organizer. I just used the quote from what one of the Department of Health case managers said to me a few weeks ago. He said, everything was so chaotic before you came, there was no way we could be here and reach them out there also. Things have been so smooth since you've been here. Direct access to pregnant patients equips them with information to make autonomous decisions, protect themselves, educate their community, and educate even their providers. Community outreach. It's about supporting providers, preparing future healthcare professionals, educating and protecting the community. So I've shared some pictures of my outreach endeavors. On the left-hand corner, top left-hand corner, you'll see a provider toolkit, which has all the information that we provide to the providers about guidelines, testing, diagnosis, and follow-up. And it also has my contact information, just in case they want to call back. On the second, oh no, I'm sorry. Yeah, that is the left side corner. On the second bottom left side corner, that's of myself giving a lecture at Kaiser University's School of Nursing to their OB and pediatric rotation for nursing students. And on the right corner there, which is my favorite, I'm the WIC lady, where I'm instructing patients at a breastfeeding class. With that, I will pass the mic over to Jessica Schultz.
All right, hello, thank you, Michelle. I am Jessica Schultz, and I am representing the Fairfax County Health Department, located here in Virginia. The population of Fairfax County is approximately 1.2 million. It is a densely populated, overall wealthy, racially and ethnically diverse area. Over 1/3 of residents age 5 and older speak a language other than English at home. And you can see from the bar graph on the left, just the variety of the linguistic diversity in Fairfax County. Can everybody in the back kind of see? Can you see the? Okay, great. 29% of students attending Fairfax County Public Schools, or almost 1/3, receive English for speakers of other language services. The Fairfax County Health Department is a locally administered health department. We serve the County of Fairfax, cities of Falls Church, City of Fairfax, and the towns of Clifton, Herndon, and Vienna. Fairfax County Health Department employs over 582 full-time employees that are divided among central administrative offices, which houses environmental health, patient care services, and emergency preparedness. We have a standalone public health laboratory, 6 district offices, 6 adult day healthcare centers, and 3 affordable primary care clinics. The Fairfax County Health Department is resource-rich and multidisciplinary. For all of our Zika cases in Fairfax County have been travel associated, and we have 22 mother-infant pairs enrolled in the U.S. Zika Pregnancy Registry. One of Fairfax County's strong points has been their use of surveillance technology. A Fairfax County Health Department Zika SharePoint page, which you see again on the left, was created for managing requests for testing and case management. Some of the highlights are that providers or Fairfax County Health Department nurses can submit electronic requests for testing, and staff can review those in real time and approve or deny those. There are workflows through SharePoint for creating lab slips or Zika screening letters for patients to take to their providers. The Zika Pregnancy Registry page is another part of SharePoint where MCH nurses are able to track their follow-up with mother-infant pairs, and communicable disease EPI staff are able to track U.S. Zika Pregnancy Registry forms. And this also allows us to send emails out to providers a week before assessments are due to remind them that infants on the registry have assessments that are going to be due soon. In addition to the creation of the Zika SharePoint page, we also have been doing annual MCH Zika trainings, which included in-depth PowerPoint presentations for the maternal child health program, from the maternal child health program, communicable disease EPI program, a pediatrician, and our disease carrying insects program. And each nurse was provided with home visiting nurse packets, which included a copy of the PowerPoint presentation, Zika positive kits for pregnant women, as well as other resources. The purpose of the training was to share information across various units within the health department and provide updates as well as education on how Zika may present in an infant so that a child could be referred to intervention as early as possible. Okay, and finally, some successes. In May of 2016, the Fairfax County Health Department created a great tool to aid women who tested positive for Zika virus, seen here in the goldenrod yellow color, what we call the Monitoring You and Your Baby's Health Card. This was created as a way to empower patients to be part of their care and help them understand the purpose of the U.S. Zika Pregnancy Registry, as well as to improve continuity of care between providers. It's two-sided, one side English, one side Spanish, and these were distributed to OBGYN offices, as well as health department staff to provide to Zika-positive mothers. And this card has been shared with various state and local health departments. And one of the areas where there was room for improvement was completion of assessments forms for the U.S. Zika Pregnancy Registry. When I first started my position about 6 months ago, only about half of forms were completed, and currently we're at 100% through 6 months of age. So that's really been a great success. And Fairfax has a total of 22 mother and infant pairs enrolled in the U.S. Zika Pregnancy Registry, as I mentioned earlier. Follow-up of the forms and completion of forms is very time-consuming. So again, we use those automated emails sent out to providers a week before to help with kind of doing that follow-up. And with that, I will turn it back over to Laura.
So now, actually, I'd like to open up the floor. Our panelists would be glad to answer your questions about their local experiences. We'd also like to hear any of your relevant experiences. Please raise your hand and I can go grab the microphone and bring it around to you.
Good question. They're recording, and I just came here from the gym, so to my state back there. I really did have a suit on earlier. My name is Connie Mitchell. I'm from California. I'm our Deputy Director of Family Health, and so I oversee WIC, maternal child adolescent health, as well as genetic disease screening and birth defects monitoring. So that was really helpful to have them all under one umbrella, and then we reached out to, of course, we're very connected to infectious disease and work together on everything. So I was wondering, I think all the things that you did were great. I think there was wonderful communication across the states. We learned from all of you. We hope that maybe there was something you learned from us. But I was wondering if there was some long-lasting changes that you've made, because I know for us, we now have a perinatal infectious disease task force, and we've kind of gone right from Zika to congenital syphilis or vaccination for pertussis in pregnant women. I mean, we're just going right into the next wave of issues. So that's been one permanent change that we've made. But I was wondering if there was other things that you see are kind of, as a result of this epidemic, you see as kind of a permanent good thing that you're going to carry on going forward.
A couple of things. One thing that's going to go forever, hopefully, is the communication between our local health departments and other areas, other stakeholders that we had throughout the state. Since March of last year, we've made contacts with DHS representatives, stakeholders, AAP, ACOG, and so on and so on, Matamoros, Mexico. So that's one thing that's being developed, and we're making those contacts, and those contacts now we have them, they know who we are, and that's going to help us for the next event that's coming down the line. Another thing, too, we're working on is sharing of information through either an HIE or other type of reporting system to the hospitals or local health departments. That's something that's been developed in Texas that we're trying to incorporate into other areas and other health departments. So that's changed the way we look at things.
I think one of the things we're hoping will have a lasting impact is that we're hoping that this model can also be used across other health departments so that it can be used for other emergency responses. For me, I think one of the things I think is key is that now I notice providers have a more open channel of communication with the health departments. They're calling when they have questions. There's somewhere they can go when they're unsure. So I think that's key, and that's important for reporting illnesses.
Questions? Anyone else?
Actually, I just wanted to add one of the things that having an assignee in our community has done is it brings the conversations, those crucial conversations, where before we couldn't. And specifically the reason is because they're also seen as subject matter experts. Sometimes as a local you're preaching it, but when someone comes from out of town and says, oh, must be true, someone out of town is here to make that statement. So the importance of that is when we're doing reports, for example, to our elected body, which we just did last week, it gave much more depth, and we were able to have now conversations, crucial again, with, for example, our hospital executives. And they understand it's a big deal because now there's a Zika ZMS portion. So where before it was getting lost in the conversations at division levels, I now see executives realizing that Zika and other emerging infectious diseases is something they need to look at, and they're turning to public health departments, and that's a very important gap that existed that I think this program is addressing to minimize those gaps. Thank you.
Thank you so much for that. Any more questions? We have a little bit of time. So I'd like to ask a couple questions, if that's all right. So Jessica, I know that one of your proud success stories was the patient card. Can you just describe a little bit about how you got those cards into patients' hands?
Sure. So part of what I also did was doing provider outreach to OBGYN offices. So we would take those out and we put little kits together. So we called them Zika positive mom kits. And so we'd put the monitoring you and your baby's health card in there along with resources. You know, what is the pregnancy registry? So those could be handed out by a provider. As well as in the clinics. So our clinics will see a lot of women to do pregnancy screenings, and then they figure out if they're eligible for what we have here is called ICCW with one of the hospital groups where they offer basically free maternity services. So they kind of come into the health department, and that's how they, if we knew they had traveled, and they could be given one of those kits as well. So that answers.
Thank you. Oh, another one.
Hi, my name is Meg. I'm from NACCHO. We've been working with CNI and the field assignees. And one thing I think NACCHO is thinking about is how are local health departments going to be incorporating all of this Zika activity into their normal operating schedule. Zika is not going anywhere, but the funding is. So as your field assignees at these local health departments, what are you doing to put the systems and procedures in place that when you are no longer a field assignee there, that the health department can continue the work and continue to support families affected by Zika?
Yes, thank you. I'll speak just really briefly about SharePoint, because that is a great digital platform where we were getting, in 2016, we received over 1,000 requests for testing and a little under 1,000 in 2017. So if you think about if that was a provider calling us, I mean, that's a lot of phone calls. It's a lot of just man hours. So this is an easy way they can go in. They have a secure link. They put patient and provider information in, and then we review that. If we have questions or concerns, we will call them, and then they get an automated email with information back. So again, that's just a huge time saver. And that's been used across different diseases. We use it, we're planning on using it other diseases. So that's just one example that pops up into my mind, that's something that saves time, and then being able to generate those automatic replies.
At least for Brownsville, what Zika did is kind of made us do a needs assessment. What are we missing? With that, we're creating a book, a procedure book for communications and such. If another activity comes up, what to do, the steps to do that. So that's one thing we're doing. Also, we're looking at data now. We're asking for data. Let's plot it. Let's do that. That's helped us get some activities in Brownsville. Also working with partnerships with the School of Public Health and other entities, universities. It's also helping us to get grants and look for grants since we have that data now. Data speaks volumes, and that's what we've noticed, and that's one thing that we want to continue. I know Art's been looking at me, what else can we apply for? What else we need this, we need that. Because, like I said, funding might not be there forever, but the needs and the activities of the health department will continue, and we just need to have either the book to follow the book, and then what funding opportunities will go next.
For me, for Broward County, pretty much we have a team. It's myself and 2 case managers, and of course the technical monitor who supervises the whole epidemiology department. So we have meetings throughout the week and pretty much have open line conversations about anything that's updated, data abstraction, any new cases, and what's being done, and we come up with ideas about community outreach so that everybody pretty much is knowledgeable about what's going on. So if I'm gone, the work can continue. There's a trail to follow.
One other thing that I just kind of think of that I'm sure everybody's doing is we're really trying to keep things organized and keep documentation of everything, because it's just a matter of it'll be another disease at some other point. So how do we, kind of, keep this model very streamlined and have things prepared for the next, the next person? Thank you.
I have another question if no one else does. Don't be shy. Okay. Henry, I know you already mentioned a little bit, and I know Art chimed in a little bit on some of the wonderful work you've done in Texas. If you could share a little bit more about your binational work, I think that's pretty unique to your region.
Yeah, like we mentioned earlier, we are working with the health department of Matamoros. We've been working, actually, we enhanced it. One thing that's happened since I've been there, we had elections, Mexico had elections, so there was a new leadership that came in. They're also having elections later on this year, so we'll see who comes in so we can, but just developing those communications. Also recently, the Secretary of Health from Mexico, due to the cases in Tamaulipas, which is our neighbor across the river, across the street, Tamaulipas had the highest increase in 2017 overall in Mexico. They had 636 cases of Zika in Tamaulipas. Since that happened, the Secretary of Health enacted Red Tamaulipipeca. It's a task force that basically told the governor, take care of it. And with that, the governor's like, what do I do? But basically, they're targeting all levels. They're putting an all-hands effort, the community, medical professionals, and even the military and hospitals to learn about Zika, identify it, prevention, and treat it. So that's one thing that's their driving force for Red Tamaulipipeca. But also part of that is, okay, we know we have Zika, but we also have diabetes, poverty, good water standards, living standards. So that's other issues that we're working with Matamoros, since it's our neighbor, it really is, to see what happens on this side, happens on that side. We both go towards a common goal. So that's what's been happening with us. We're also developing shopping bags with our logos on it, little Zika thing and informational to be used on both sides. Since, like I said, 1 million crossings per month, that's 40,000 people a day going back and forth. So we want to take advantage of that. So we're trying to enforce and basically to get that together. Another thing that's happening is the state of Texas passed 2 laws last year. One was for the local health departments to talk to other agencies without fear of repercussions of HIPAA. The need to know kind of got laxed, but there's still a little bit of need to know, which is great. And the second thing was they set up a Senate Bill 1680, was a binational border initiative in 4 counties, all the counties along the Texas border, to basically let's work with Zika, let's work with the other health issues, strategize to make the border better. And so that's 2 things that have come up, and we're working, I'm pointing to Art, he's here, and we're working to get those communications across going, either Matamoros at the state and actually at the Mexican national government area. So it's a lot of work.
Thanks, Henry.
Again, Connie Mitchell from California. I'm sure that you were educating women about the importance of contraception, but I was wondering if you did any kind of active outreach or local clinics that you set up, or if you did anything else to really help women who were at risk and you wanted to minimize. So I just was interested in that.
At our, the county basically through the WIC clinics did an initiative on providing Zika information. Outreach activities that we have during the year, we brought that out, and that's one thing that's always getting us into trouble, or no, not trouble, but they, once we keep telling prevention, once the baby conceive, prevention, they're like, I'm not cheating on her. No, that's not what we're talking about. We're just, so it tends to, the conversation can get a little bit sticky, but we are pushing that along as we do things. It's very important. That's one of the things that we have.
At the WIC clinics, I do talk about if your spouse traveled and he may have been exposed, how to keep yourself in the pregnancy safe. But we usually defer any contraceptive method, that kind of education to the providers. I usually defer that to the providers because they also get some education and they do that. But with me, in my role, it's always been, okay, if your husband traveled or if you traveled or you guys or someone tested positive with the Zika virus, this is how you can protect yourself and the baby. Abstinence, which is almost impossible when you're, when you have a partner, or, using, a condom so it doesn't transmit. However, it's an iffy conversation to go into as far as prevention of pregnancy or anything else like that. So we usually defer to the providers with that.
I was just going to say my local health department, as well as the state, created what we called Zika prevention kits. So those did have condoms in them, and they had insect repellent and lots of CDC as well as local resources in them. So those were handed out to OBGYN practices as well to hand out. And really anyone that requests them, if we had family practices or things like that. And also clinics. We have a partnership with a local university, and they offer, their nursing students offer free clinics, I think monthly. So those were also given to them. So Zika prevention kits, yeah.
Great, thank you. Unless we have any other burning questions, we can move on. So thanks for all of your questions, your contributions. Before we close, our panelists have a few pieces of advice that they'd like to share. Henry? Oh, I stole the microphone, sorry.
Some key takeaways that we have, sorry. You can't do it alone. You need to network, and that's what we've been talking about earlier. But when you network, you need to be ready for the ask. You ask this question, what do you want us to do? Be ready with all door-to-door campaign, handouts. So be ready with that information. Also make a list of all your communities as much as possible. Network. Okay? Find a hook. It's very different on the different audiences. As we talked about with some pregnant women talking about their babies, keeping them safe is fine. With older women, they're like, well, I don't have to worry about it. I'm not going to get pregnant. But you can get bit by a mosquito. Now you're a carrier, mosquito bites you, and then your pregnant daughter comes in, now she has it. So just teaching that on different levels. We're doing find the hook for doctors. Be ready for the data. Whatever data you have out there, you can use NED's data. We've used that for doctors. What doctors are the high testers. We've told them, and they're very happy. They want to be the first. They want to be, hey, I'm the one in the city. So use that data, have the numbers. Also, because doctors, they often ask, so why do you want to test? Why do we test? And we tell them why, and then we kind of, try and prompt them, find the hook and stuff. And also drive the message in all forms. In communications, we use the GIS map, we use TV, radio, social media, different languages. And when you think you had done enough, you really haven't. We found that out. Actually, Harvard came down to Brownsville. They did a study back in the fall. And they gave us some good takeaways that kind of reaffirmed what we knew. that we needed more. We needed to do more. We did a lot, but we need to do more. One thing, although the residents gave us high marks as a public health, either as a city, county, state, and that information, they felt very comfortable in the information they were giving us, there was still a gap on, have we reached out enough? Well, have we tried this radio station, other radio stations, other forums? So we knew it's like, and when we're asking for funding, see, Harvard says we need to do more. That was very helpful. So it's when you think you've done enough, you're gonna need to do more.
Ask for help. I think that was the most important to me because I was blessed with a great group of colleagues and also my CNI management team. They're always available. And there are times people don't know the answer and they say, okay, we'll get back to you, and they get back to you. I've been able to pick the brains of the field assignees in Florida as well as in the other states, and usually we're able to collaborate and come up with some solutions that each of us may be having. So asking for help is always great. Educating the physician staff. I found that's very successful because OBGYNs are always busy. If they're not seeing a patient, they're delivering one. Pediatricians are seeing so many kids. So most of the time, it's very unlikely that you're gonna get to speak to the physician when you go to the office. But when you educate someone and their staff, someone will always know the right information, or at least some of the information. And if they need clarification, they can always call you, because of course you're gonna give your card and somebody will call you back. Empower clients to take control and make wise decisions regarding their health. I always say that an autonomous client is most likely gonna be the client that's adherent. They'll take the information back to their family and to their community. So they're pretty much doing the work with you. So empower clients is very important. Seek opportunities to build partnerships. Sometimes there are budget issues and you need resources. When you build partnerships, those people sometimes, most of the time, they have resources that you can use and you can share. So it's really important to keep those good relationships going, and they'll call you and tell when there's an opportunity, when there's a march or there's a walk, or you can present at. So that's important. And immersing yourself in the project. When you immerse yourself in the project, you always think of ways to target your at-risk population. Which way can I get to this person? Who is most at risk, and how do I get to them? So that was one of the things we did with the WIC classes, because pregnant women they're really who we're most concerned about. And if you think about 18,000 babies being born to women in WIC classes annually, you're pretty sure to get a good chunk of them throughout some classes during the week. So pretty much make the project your passion. And that's what's worked for me so far.
My key takeaways are first, tailoring your resources to your community. Fairfax County created various resources that they felt would meet the needs of their community better than those that were already created, or even had created some that weren't yet created, like the monitoring you and your baby's health card, and also really sharing those resources, throughout the agency and also to external partners. Second is the importance of internal coordination, involving your various parts of your health department from the start, because everybody is able to provide different resources or ideas that make the response better as a whole. And finally, using a platform like SharePoint, which I talked about earlier, with the questions, which is a secure database for online requests for test and case management that can save time, as well as provide a place for multiple agencies to share and access information. Thanks, Laura.
So thank you all for your conversation. Should you be interested in talking to any of us further, the panelists will be available for a while after the presentation. There's much more information available about Zika on the CDC website, and you can reach out to me or to Denise, and I'd like to take a minute to recognize Denise Underwood. She's in charge of the CNI Local Health Department Program Manager in red, and also sitting next to her, Leslie. Thanks so much for all your work. And you can reach us at the email addresses that are here. In closing, I want to again emphasize that Zika virus disease is a challenging, emerging public health issue with special concerns for pregnant women and their fetuses and infants. The CDC Local Health Department initiative is the work of so many people. I particularly want to thank our colleagues at CDC, especially Nicole Fehrenbach, if you don't mind being recognized as our CDC sponsor, as well as all of the health departments that have collaborated closely with us throughout this initiative. It's been a privilege and an honor to have the opportunity to work with so many committed individuals and partners. Thanks again for listening today, and please enjoy your evening.